discussing our work, Discharge to Post-Acute Care as a Quality Measure, a benchmarking study in older adult surgical patients. This was recently published in JACS. Older adult surgical patients that are discharged to a post-acute care or non-home setting postoperatively have worse outcomes than their counterparts who are discharged home. We asked the question, can discharge to post-acute care be utilized as a quality measure for hospitals, much like our other more common quality measures, such as morbidity and mortality? We used NSQIP data from January 1st to December 31st, 2023, and we used patients from age 65 and older who were admitted from home or a permanent residence and discharged to post-acute care. We built 3 different models. The first was our primary model, including all patients. Then we looked at the same model, but excluding patients with a major morbidity present at the time of surgery. And lastly, we looked at the top 25% of patients who were at highest risk for discharge to post-acute care. The results from our primary model can be seen in the top image. There were 494 hospitals and 277,160 patients included. 11.2% of patients were discharged to a post-acute care facility. There were 24% of hospitals that were high outliers in the red bars, and 16% that were low outliers or discharged less than expected percentage of their patients to post-acute care in the green bars. Our next model with the exclusion of PATOS can be seen at the lower half of the screen. There were 494 hospitals and 263,866 patients included. Slightly less of the percentage of patients were discharged to post-acute care as expected at 9.4%. And there were still a similar number of high and low outlier hospitals. 22% were high outliers in the red bars, and 16% were low outliers in the green bars. So there were a clinically significant number of both high and low outlier hospitals. It's not pictured here, but for the model with the 25% highest risk patients, it performed quite similarly. Overall, this study demonstrated that discharge to post-acute care can be utilized as a quality metric for older adult surgical patients with a clinically significant number of high and low outlier hospitals. This is consistent regardless of the inclusion or exclusion of PATOS cases and whether the patients are highest risk patients. In the future, we could look at how readmissions affect this. For example, we are planning to look at whether or not the patients that are discharged home are more frequently readmitted than patients discharged to post-acute care, and if there are a clinically significant number of high and low outlier hospitals for patients who are sent home after surgery and stay at home rather than being readmitted or discharged to post-acute care. Thank you.